Hello everyone! In this short video you'll learn about high altitude sickness, AMS in short. My name is Jakob, I'm a certified medical doctor and I prepared this video for my recent trip to the Annapurna Circuit in Nepal. So, let's begin! Under the term AMS we summarize many various symptoms. The first warnings are always headache, nausea, vomiting, dizziness, or breathlessness. Let's call them hangover symptoms. If you travel at high altitude, let's say above 3000 meters, your body suffers from many things. But the biggest concern is hypoxia. In other words, the lack of oxygen in your body. Hypoxia happens because the air pressure gets lower and lower with the altitude. And every gas particle needs more room. It expands. That means fewer oxygen particles per liter of air. At, let's say, 3000 meters, you only get 2/3 of oxygen you would get at sea level. And it gets worse the higher you go. Your body cells need oxygen. If your cells, especially the one in your brain, don't get enough energy, it causes the previously mentioned hangover symptoms. But if you think hangover symptoms are the worst, you're wrong. It becomes rapidly alarming if you get edema. Edema is an accumulation of water in your body where it doesn't belong, simply. He's got fluid. It happens when your cells are completely out of oxygen. Then your body tries to squeeze the last few oxygen atoms into your suffocating cells by increasing the blood pressure. Unfortunately, the pressure is so high that it pushes the water out of your vessels. There are two main types of life-threatening edema you can experience in the mountains. The first one is edema in your brain. It is called HACE, high altitude cerebral edema. The other one is in your lungs and it's called HAPE, high altitude pulmonary edema. The first one, HACE, feels like if you're being drunk. You are dizzy, you feel euphoric, you can't remember where you are or who's with you, you can't walk in a straight line, and in the end, you simply black out. I hope you get why this is life-threatening in the mountains. HAPE feels like suffocating because your lungs are full of water. Its main symptom is extreme breathlessness, even when resting. If you experience the signs of AMS, just descend immediately. Mild hangover symptoms are just a warning sign for your body and you have enough time to react to them. If you only have mild headache, it's sometimes okay to just stop the climb. It all depends on the severity of your symptoms. In a hazardous mountain area where every mistake can be life-threatening, it is crucial to have a clear mind. With all the drunken behavior caused by haze, most people die from falling, freezing, or simple apathy. The danger of HAPE symptoms should be obvious. You drown, but from the inside. There is good and bad news. Bad news first. You can't train against AMS. I can already hear the fitness fans angrily typing in the comments. But the truth is, training or physical fitness does not impact the risk of getting sick at high altitude. And there's no simple way, no simple medical test to find out in advance if you will get sick or not.
Good news, everyone!
You can still prevent getting sick to a certain extent. The magic word here is acclimatization. Acclimatization is the process in which your body adapts to the changes of air pressure over time. It consists of three main steps. In the first step, your breathing rate increases to get more oxygen in your lungs. The blood pressure increases as well to get more oxygen in your cells. This adaptation happens in minutes. For the next step, your body needs roughly 2 to 5 days. During this time, your kidneys starts to compensate for the lack of CO2. You constantly breathe out with every breath. While breathing, you exchange CO2 for O2. CO2 is acidic, so the pH value of your blood starts to increase. It becomes alkaline. Your kidneys can counter this effect, but need time to do so. Your liver and the other organs slowly adapt as well and need less oxygen for their energy consumption. Step 3. The last step of acclimatization needs several weeks. Your body starts to make more red blood cells to carry more oxygen through your blood vessels. Your body increases the amount of EPO, short for erythropoietin, which stimulates the production of red blood cells. It is, by the way, an accepted way of doping. The illegal way would be to inject EPO directly with a needle. There are some basic rules to give your body the time needed. Ascend gradually if possible. Above 3000 meters, you should climb around 500 meters from one sleeping point to the next. Consider an extra acclimatization day every 1000 meters and avoid alcohol and smoking altogether. To prevent high altitude sickness, all you need is time for your body to adapt. If you stick to these simple rules, you will improve your sleep, cognition and comfort, and probably you will avoid all the AMS symptoms altogether. If you have more detailed questions concerning your own medical conditions, please ask in the comments below. Certain pre-existing medical conditions, such as heart failure or any form of pulmonary disease, can increase the probability of AMS, but the main risk factor is the history of prior AMS. If you had any signs of AMS in the past, you should carefully listen to the next chapter, pre-medication. Before we jump into possible medication, a short disclaimer. Most of the drugs I will talk about are available only with a prescription. I do not know your medical history, so definitely consult your physician before taking them. Acetazolamide, I don't know how to spell it correctly, sorry, or also known as Diamox, is one of the most commonly used drugs against AMS. If you have a history of AMS or a rapid ascent is unavoidable, you can benefit from Diamox prophylaxis. It acidifies your blood and reduces the respiratory alkalosis associated with high elevations. Do you remember when I told you that fast breathing makes your blood alkaline? Diamox counters this effect by influencing your kidneys. The side effects are increased urination and sometimes paresthesia or tingling of fingers and toes. If taken before ascent, Diamox can prevent AMS. It can also help speed up the recovery if taken after the symptoms have already developed. An effective dose that minimizes the common side effects is 125 mg every 12 hours, beginning the day before and continuing through the whole ascent. But you can even take half of this dose every 12 hours to avoid side effects and, depending on your body weight, still have a very satisfying result. I used it during my recent trip to the Annapurna Circuit in Nepal, and I can recommend it. Dexamethasone, better known as cortisone, is highly effective as an anti-inflammatory drug. It is used as a rescue or standby medication when AMS symptoms occur. A recent trend is using it only during the summit day to prevent abrupt symptoms. If you use it only for a short time, you don't have to worry about side effects. I recommend dexamethasone combined with immediate descent as a kind of emergency haze treatment. For prevention, the most common dosage is 4 mg every 12 hours. For acute treatment, you can cut this time in half and take 4 mg every 6 hours. Both mentioned drugs are effective against early symptoms of AMS and haze, but not against HAPE. If you have a pulmonary hypertension or a history of HAPE, you should consider using nifedipine or one of the drugs of the same group. An example of such a related drug is Viagra. Yes, Viagra is a highly effective drug against suffocating at high altitudes. But nifedipine is most commonly used against HAPE symptoms. The dosage is 30 mg every 12 hours. If you want to treat only mild symptoms of AMS with no effect on acclimatization, you should always have some mild painkillers like ibuprofen with you. Ibuprofen treatment is not inferior to Diamox when it comes to mild symptoms. You can take up to 600 mg every 8 hours. Ibuprofen, aspirin, diclofenac or others are available for everyone, are cheap, and most of you have experience with them. If you want us to do more such medical explainer videos, let us know in the comments. Maybe you like to know more about travel pharmacy or vaccinations. If you do so, consider subscribing and give us feedback if you like or do not like this video. Until next time.